Hi, my name is Lynn Martins, and depression is the topic I chose for my integrative review. So, a few facts about depression. Depression is defined as a sad, lonely feeling, um, not being able to enjoy the activities once did enjoy. For some folks, it includes weight gain or weight loss and interruptions in sleep patterns. So, facts about depression in adults with depression, this is my PICO question, is how does cognitive behavioral therapy compared to usual care lessen depressive symptoms over 1 year? So that's the PICO question I was trying to answer. So as for depression, it is one of the most common disorders in primary care. It's associated with impairments in function and um, premature mortality. So, among United States adults 18 and over, it was estimated in the year 2017 that 17.3 million adults had at least one depressive episode. So, the theoretical framework that I chose Catherine Kolkaba, and uh, her theory was based on comfort, the theory of comfort. And there were three forms of comfort. There were relief, ease, and transcendence. And so when the needs are met of a patient, they can feel relief. Also, the ease is a state of contentment. And then the transcendence was having the ability to overcome the next challenges or obstacles in life. So, Catherine Kolkaba thought it was successful. The process to achieve the goal to this comfort would be to not only assess the comfort needs of the patient, but plan how to achieve that comfort and then follow up to make sure that the plan was successful. So the level 1 article I chose in the review was, it's called Psychological Interventions to Prevent the Onset of Depressive Disorders. And the purpose of the study was to prevent the diagnosis of depression. And it also was a 1 year follow-up, So it was 50 studies and over 14,000 participants. And those participants were put in groups, three groups, and they were assigned cognitive care. The second one was care as usual, and the third was a control group. So after all the groups, the results were that there was a 19% less chance to develop a depression diagnosis if the patient was assigned to the cognitive behavioral therapy group, showing that cognitive behavioral therapy is successful in lessening depressive symptoms. So the second article, the level 2 article, is called Cognitive Behavioral Therapy for Treatment-Resistant Depression in Adults and Adolescents, a systematic review. So for the purpose of this class and my PICO question, I did not look at the results for adolescents. So the purpose of the study was also to reduce depressive symptoms, and the follow-up period was 1 year. And so there were 4 studies involving adults, and there were 722 participants. So the the participants were divided into groups of cognitive behavioral therapy and treatment as usual. That was one group. The second group was treatment as usual alone. And so after studying the results of those two groups, the outcome was that cognitive behavioral therapy patients had reductions in their depressive symptoms. So the third study, the level 3 study, was a level 3 article, was Experiences of Guided Internet-Based Cognitive Behavioral Therapy for Depression, a qualitative study. So this group, there were 88 participants that went through the entire study, but they only chose 12 of those participants to be interviewed and to get their thoughts on the program that they went through. So there were 3 groups, and one was called a self-help group, where they received the cognitive behavioral therapy through a self-help group, which involved a minimal therapy or therapist contact. But in this group, there were 7 modules and it went over 8 weeks. So the second group was called a email individualized internet-based email therapy. And so there were no prepared texts and there was nothing prepared. You were kind of on your own. And also the third group was a delayed treatment therapy group. And so the results of this were the group that had self-help with the minimal therapy. The qualitative or the subjective statements proved that cognitive behavioral therapy was the most beneficial. Some of the other comments in the other groups, they said they felt like they couldn't control it, that meaning the program, or they gave up after a while, or put simply, they couldn't find time for it. So those groups were not as successful. So through the literature search, it confirmed that cognitive behavioral therapy was a proven therapy for reduction in depressive symptoms, delayed diagnosis of depression, and a treatment option in internet-based therapies. And so thus it proves the PICO question, in adult depression, does cognitive behavioral therapy reduce depressive symptoms versus usual care in the course of a year? So that was found to be successful, and the literature proves that. And then the next slides, the next things also are, it could be used in outpatient therapy, telehealth, or internet-based programs. Thank you so much.